Holidays are fast approaching, and a typical holiday meal can easily give you a day's worth of sodium. Now, doctors warn eating foods high in salt could increase your risk of developing kidney stones. Joining us live is Dr. Wong, a urologist with Hartford Healthcare's Tallwood Urology and Kidney Institute in Norwich. Doctor, welcome.
Thank you so much.
Great to have you. So how does increasing salt intake raise your risk of developing a kidney stone?
Well, I think what people don't realize is that increasing salt in your diet directly increases the calcium in your urine. And a lot of people know that calcium is a component of most stones, actually. So the more salt you ingest, the more calcium will end up in your urine. And that's just the way our kidneys work. So that's something to keep in mind.
All right, so holiday gatherings will start a week from Thursday. So what other foods can play a role in increasing your risk of developing a kidney stone?
Yeah, so unfortunately, this is a meat-heavy holiday, and the other major risk factor in our diets is animal meat protein. So animal meat protein, which typically is always salted, will also increase your risk of stones. Specific to Thanksgiving, I would also keep in mind that things like spinach, okra, beets, sweet potatoes, a lot of these popular vegetables that we eat around this time also increase your risk of kidney stones.
All right, doctor, talk about some symptoms associated with kidney stones.
Sure. So symptoms typically start with flank pain, and that would be pain, in the back, radiating down to the front, to the lower quadrant, to the groin. It can also be associated with nausea, vomiting, as well as blood in your urine, and a constant feeling that you have to urinate as the stone gets close to your bladder. So if you see a combination of these types of symptoms, you may be passing a stone.
All right, tell us, when should someone see a doctor?
I think it's important that if the pain or if your nausea become difficult to manage at home, that's when you should definitely seek treatment. In addition, if you have any signs of a severe infection, such as fever, chills, and you're having flank pain, blood in the urine, that's a trip to the emergency room.
All right, and doctor, quick last question. There are different kinds of kidney stones. We hear about uric acid stones and calcium. What are the differences, and can what we eat impact both of those?
Yes, so uric acid is not as common. I would call, about 10%. Calcium-based stones, about 90%. So uric acid stones and calcium stones are associated with animal protein intake, but uric acid stones even more so.
All right, Dr. Wong, urologist with the Tallwood Urology and Kidney Institute. Thank you for joining us. Some great information.
Thank you.
Thank you.